Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today I'm really excited because we are introducing a new service into the office next month, and that's called teeth whitening. And it's not a new thing, but a lot of people clamor for having white teeth after they're done with their orthodontic treatment. And one of the things that you've all been asking is, hey, can we just do it in your office and get that done? And so one of the things that we've considered over the last couple of months is really how to bring that service into the practice, and we're really excited about being able to deliver on that. And so what I wanted to do today was really talk about teeth whitening. And teeth whitening, for people who don't know that much about it, I'm just going to kind of give an overview of how the process occurs. And so there's two types of stains that occur on teeth. One are called extrinsic stains and one are intrinsic. And extrinsic means that they're on the outer surface of the teeth. And so a lot of the over-the-counter products that are formulated, they really deal with that level of staining. And so the staining that are on the outside surface of the teeth. When we talk about having a dental professional do teeth whitening, what we're really talking about is really trying to get the intrinsic stains of the teeth out. And the intrinsic stains, where they kind of reside, are within the micro cracks within the enamel and into the dentin. And so when we're using teeth whitening agents, those whitening agents are either carbamide peroxide or hydrogen peroxide, and it's that chemical agent that gets in between those cracks and goes in and sort of releases oxygen so that the intrinsic stains are just turned white. And so that's really how, like, in a quick nutshell, that's how we get rid of intrinsic stains. And so when you're making a decision on whether you use an over-the-counter product or have us do it in the office, that's really what you want to look at. And so what I want to do now is talk a little bit more about dental professionals delivering the teeth whitening. And so what we do is we provide you with 3 different ways to get the teeth whitening service. So for some people, they like to have custom fitted trays made, and they like to take home these trays and do it in the comfort of their home. So what we do is we provide you with we take an impression of your teeth, and then we make you a custom fitted tray that allows you to apply the carbamide or hydrogen peroxide solution over a period of days until you get your teeth as white as you want them to be. And so you get to do that in the comfort of your home. The second way, which is a little bit different, for people who want to maybe like a cost alternative, something a little bit less expensive, then we can do preformed gels trays, and that's sort of like teeth whitening on the go. And so you get these like prefabricated trays that we match to your size, and they have the solution in it, and then you use those trays to get the teeth whitening effect that you're looking for. The third way, which is the most immediate way, which really needs to have a dental professional oversee, is the one where you do it in the office. And in-office whitening, the results are pretty immediate. And so for people who have a big occasion or like immediate gratification, that's probably the choice you want to use. That would probably be the choice you want. And so now those are the 3 different ways to do it. So those are the 3 different ways that we will be offering the service in the practice. And so I really invite you to ask any one of our team members which one will best suit your needs after you get orthodontic treatment. And even for people who are in our practice, parents, you have big events coming up who may want to have teeth whitening completed. So that's a service that we're going to be offering and extending to all our friends and family of E&S Orthodontics. Now, one of the questions that happens is that when you get teeth whitening, a lot of people experience some tooth sensitivity, and that is a side effect of teeth whitening. But there's different formulations and different products out there that can decrease sensitivity while you're actually whitening your teeth. And that's one of the products that we've chosen to do. So we'll be able to highlight that a little bit better for you in the future. The other thing that people always ask is about, like, hey, do I need to have whitening done with those LED lights. And I just wanted to like just share or like kind of debunk a myth that you need to have the light to actually activate the gel to make your teeth whiter. And I just want to let you know that most studies out there show that having LED activated whiteners don't necessarily cause more whitening to occur. You got to remember, it is the solution that we use, that's the chemical agent, and the concentration of that agent that actually makes a difference in terms of how white your teeth are going to be. So just keep that in mind in the future. Now, the last thing I want to talk about is about having the service in the office going forward. Again, we're excited to be able to offer it to you. I think it's going to make a big difference for people who are planning different events. And there are different types of whitening products or whitening solutions that you can use while you're even in braces, and we can talk to you about that as well. Okay, well, I really appreciate your time. Again, we look forward to seeing you next week at the next Friday Focus, and have a great weekend.